How you answer the clinical style questions in your next nursing interview can literally make or break the interview and could potentially cost you getting that dream offer. I know because I recently talked to a new graduate nurse who was not prepared. She wasn't expecting the questions. They literally put up an EKG, gave her a case study, and asked her to interpret the EKG and specific questions about the case study that she could not answer. She was literally lost. So I don't want that to happen to you. So please watch until the end. So trust me, it is not enough just to go to Google or AI, whatever AI, Claude or Chat that you use to ask about questions. You need to know exactly what you're talking about when you are going to these nursing interviews, because you will get asked clinical style questions. Ain't no doubt about it. And you need to know your preferred specialty, and you need to know it well. If you're particularly going to the ICU or the ER, you literally need to know just about everything. But we're gonna dig into this, so watch until the end. In this video, I'm gonna share the do's and don'ts and how you can nail your next clinical style questions in your interview. So if you're ready, let's get into it. Number one, the interview pitch. If you watch my past videos, I cannot stress this enough. You need to have an interview pitch when you are starting the interview and introducing yourself. And you need to do it with confidence. The delivery is important, how you say it, your mannerisms, your facial expressions, how enthusiastic you are when you introduce yourself. And it cannot be boring. It cannot be the boring type of introduction that everybody else says, because you need to stand out. How do you stand out? You need to be disruptive. Do something that they are not expecting. Watch some of my other videos where I break this interview pitch down. You need to have it down. And how are you going to know to get into your interview pitch? It's just the beginning of the interview. It's literally about a 1 minute to 90-second pitch that you will go into when they ask you, tell me about yourself, or if they say, walk me through your resume. Don't get it confused. This is literally just how you will start any interview. So go watch that interview pitch after this video. Do not sleep on this interview pitch, because within the first 5 minutes, I can tell who has prepared and who is confident and who is competent, okay? And the first 5 minutes can literally decide if you get hired or not. So that's number one, interview pitch. Number two, you'll get asked a lot of clinical style questions. Again, it depends on the hospital system and who's interviewing you. But again, I've gone through this so many times myself and have helped over 200 nurses, and I speak to nurses every single day. You will be asked a clinical style question, and not just one, sometimes multiple. So you need to know how to answer them. So my biggest tip is know every single emergency in your preferred specialty. What do I mean? Let's say you're going for a pediatric interview. You need to know pediatric type emergencies that can happen. Often for pediatrics, those are respiratory emergencies. Very unlikely that they have cardiac issues unless they have some cardiac history that they were born with. Typically, it's respiratory issues that happen and that go into emergencies. So typically for pediatrics, their condition can change super quickly. Their vital signs are all over the place. So you need to be very familiar with the wide range of vital signs and all the different emergencies that can happen. They also have other things that happen to them, such as choking or foreign bodies that they put in their nose, ears, things like that. So you need to be very familiar. Especially with babies, they might have things like croup, for example. So that barking type of cough, you need to know how to manage it. So know the signs, the symptoms, how they present, and the interventions that you need to implement in terms of medications, potential diagnostics that they may need, like x-rays or things like that. and anticipate the plan of care. Example, if you are going to be an L&D nurse or postpartum, one of the biggest complications is hemorrhage, whether it's pre or during or after, you need to know about hemorrhage. Another thing is eclampsia, preeclampsia, placenta previa, all those obstetrical emergencies, you need to know if you're going into women's health. That is my biggest tip. Know all of those emergencies. And you also need to know just the general type of emergencies that we'll get into later, which I actually have a specific video where I go into all that, and I'll share that at the end. But, you need to know chest pain, shortness of breath, all those types of common emergencies that can happen at any time to any patient. So, number 3, listen to the question and try to decipher, hey, what are they actually asking me here? Do they want me to share a story where I'm demonstrating my competence? What are they exactly asking? If the question is too vague, try to ask for some clarity, but don't probe too much, because they're going to be like, does this person know what they're talking about? A recent client that I actually prepared for an interview, she got a lot of clinical style questions, and here are a couple of questions that she got asked. Which order would you see the following patients and why? They want a rationale, and they want you to literally list which patients you will see first. They might give you a list of 3 or a list of 5, and you better have a good rationale. And simply just talking, right? We know ABC is often airway, breathing, circulation, but it depends again where you are. Are you in a trauma setting in the emergency department? And then they might say, tell me a time you received constructive criticism and feedback. They want to hear if you're coachable, are you able to take feedback, and how your character is. Are you going to get upset and get defensive, or are you going to accept it, right? They want somebody who's coachable, especially as a new nurse. And then the other question was, tell me a time that you needed to convey something critical to a doctor, a patient, and how did you communicate this? Again, this is clearly a communication style question. But again, what are they asking? Do they want you to show that you communicate clearly, effectively? And if it's a critical lab value, they want to see how you're communicating with that urgency, especially if you're working somewhere like the ICU or the emergency department. So those were some questions specifically that they asked. And this was just a couple days ago. All right. And then let's get into understanding the types of questions that they might ask and what they're looking for. So they might ask you an assessment type question where they want to see if you're going to pick up on the assessment piece. How do you assess patients, right? And I have other videos on this, right? Stable versus unstable. They want to know how your assessment skills are. So there's an assessment or intervention. Sometimes they want you to expand a little bit more on, do you know what the intervention is going to be? Whether it's a medication intervention, a repositioning, whatever the intervention is, but they want you to do something. Then they want to know your thought process. How do you think about things? They want you to literally say it out loud so they know your thought process, your reasoning. Are you able to critically think? And that is more of the outcome. They want to know what actions you're going to take. Are you going to intervene quickly and do something and then escalate it to the physician? Are you going to call a rapid response? Are you going to call a code? What are you going to do? Then they want to know, do you pick up on changes? A change in the vital signs, a change in condition. Are you able to pick out those things? Whether it's a physical change on the patient's body, like a rash, or an assessment where you're listening to the lungs and now the patient is wheezing, or is it a slight blood pressure change that you need to pick up on? Those are the things that they're going to be looking at, and how quickly are you going to react and what's going to be your next move. And then they want to know how you handle stress. So have some examples for that. Definitely do have examples. If you want to dive deeper, you need to come to my free webinar. The link is below in the description. I break down all my strategies, my frameworks. You'll have an opportunity to ask questions. And in this webinar, you'll find out exactly how to get hired faster and how to land this dream job. So I share so many things in this webinar that I don't share on YouTube. So definitely sign up for this next free webinar below. And if you're thinking, I don't even know where to start with all this interview prep, as I mentioned, I've helped over 200 new nurses. So definitely come to this webinar because they are all landing their dream role in less than 90 days. Okay, next step, okay, know your priorities. One of my new clients, like I said, they asked her these priority type questions. Who are you going to see first? What are you going to do with these other patients? They also want to know your delegation style. Are you able to delegate, and are you able to delegate correctly to the correct staff? So if you want to go deeper into this, check out my next video on clinical style questions. I have a whole video on that alone. You don't want to miss it, okay? The other thing I want to tell you, do not go on any big rants. Don't start rambling and talking and talking. If they ask you about a time you did something, the story needs to be concise and to the point. Like, get to the point. Don't start sharing irrelevant information that will bring you into a rabbit hole. And then they're going to start asking you more questions. And if you don't know this patient very well in terms of all of the labs, all of the diagnostics, it'll be very difficult for you to answer. So let's not overshare and say too many details if you can't back it up. It needs to make sense, like make it make sense clinically, okay? Because they're gonna start. Number 7, get certified. My biggest tip to any of you going into critical care, labor and delivery, ICU, ER, telemetry, cardiac, anything like that, you need to have an EKG and an ECG course. Remember in the beginning, I talked about that one nurse that talked to me and told me that they put up an EKG in a case study and she was lost. This is why I tell my clients to take the AACN, the ECG course, and the EKG course. And it's one of the best courses. And you need it for orientation as well, so you know your stuff. And most nurses miss this. I think it's like $140. It is the best $140 that you will ever spend. And not only will it help you get the job because you'll put it on the resume, but it will help you be a better nurse. And it could literally get you a 6-figure role. Hello. So now that you know the do's and don'ts that could make or break the clinical style questions in your next nursing interview, here's the thing. Knowing what not to do is half the battle, right? But you need to answer with confidence and structure, right? So you'll still walk out without the offer if you don't know how to deliver it with confidence. So in the next video, I break down exactly how you should be answering these clinical style questions so that you sound prepared, competent, confident, so that you can get hired, right? That is the whole point of this. Okay, so watch this video next, how to nail your next clinical interview.